mida mwaka nane je mbot kutoka tini kimotano paka ye mida mwaka ndoli nane ki panan o yi umira mo tanya de kutonda kal ki ya o ko sisole angwan no ba mut ke pan ke paka kareran kutonda yi gubal o yi na ko masira mutat ke ku ta paka kareran o masira mutat nyoye mida ne de bi ka jala ke ta mutat ne ko ngo so basida ko mutat
kimi nyumun tapi yomun ngata do ngonyei gwa ta pete kutumai yole pirengwa kutur ji le yewa jamne ta ke pinyo andate wiye la kuna msasiano lasma te we nkinyo glen roto kwa toni ya nyini ki pangala bi pakan we te ya nyumun wo roto kya pa kya so wanyole ndene mun nyawe yende gi yetu nyumun ato ya nyumbe ye sisweji ni minye chona chamata mule kinete ja kasini tin o kinete ja kasini tin nyakaram inde yesu yan tin yesu yan kikaji nyaman ni minye lo te gilmo bol
Our first result is to have reduced social tolerance to SGBV in southern Karamoja through promotion of community dialogue and behavior change. A cadre of community change agents, women groups, traditional and religious leaders have been identified from practicing communities. Change agents have been trained on SGBV, SASA behavioral change methodology, advocacy and gender-responsive policies and laws to facilitate community dialogue on SGBV FGM. We have trained 98 people. Change agents managed to conduct 183 community dialogue in which 13,842 people from communities were sensitized. C&D strengthened the existing school health clubs, 3 per sub-county. 87 health chats were conducted, 48 with school clubs and 39 with existing youth groups. The project has developed materials such as t-shirts, posters, leaflets bearing messages on prevention and response for SGBV. Such messages are key in mobilizing the community to work together against SGBV. 500 copies of the Simplified Anti-FGM Act and UN Resolution 1820 and 1325 were printed and distributed to stakeholders, including change agents within the 3 districts. The printed copies are pocket-sized and are thus very handy and available at all times.
Kaya tanyo karam nyo panyoman mbab choni ki por weja ta ki ngara ki ja chane la sere nyo wo wala go nyu jante la ni ka so nyar nyo gaga bisa mbolo ko por ya nyete la ni go cha mutin ni ko muta mon rata ka ta ga ngale ta bai si andi aso wala ki tiga nyama chona motata ka por ya mon nga bata baka ta ma monda nyamba mu alenta wotai amma wotonyi to nguna mon ki ma mon ona sere nyo wo kwa ko ko ngale ndona.
Part of the sustainability, one, we have these change agents who, some of them are LC1 chairpersons of their villages. Others have been like the cutters, those ones who are cutting these girls. Some of them are now our change agents. Others are religious leaders. Others are representatives of the elders. And then some of them are also representatives of the youth who are from these communities. Even if the project ends today, now that some of them are beginning to own some of these projects, you'll find that with the SASA approach, where you don't need to collect a group of people and talk to them, in as long as you are 2, 3, 4, 5 people, you begin discussing some of those issues, bring a topic, they discuss, and see how best you can agree. Look at all the 2 sides of the problem which you are discussing about. Then later on you see how best the community can change. So I feel that is one of the sustainability program or project of this sustainability issue of that project in case it ends. Now that we have these people with us.
The public is now aware, even if the project ends, the public is now aware the referral or the reporting mechanism. They are now aware of the reporting mechanism, where we have the CPCs on the ground and the change agents on the ground. When any of these occurrence happen, you find the flow of information is very fast to us, the police, and we're able to handle it appropriately and quickly.
A conducive legal and policy environment is created for strengthened accountability for SGBV prevention and response for women and girls. HearInIt worked with existing national level advocacy forums to support and influence implementation of gender-responsive policies, including the Domestic Violence Act of 2010, Anti-FGM Act 2010, and the United Nations Resolution 1325 in 1820. Addressing SGBV in southern Karamoja requires measures that promote and protect women and girls' rights and actions for intervention when those rights are violated. The rights holders influence duty bearers at 3 levels: sub-county, district, and national level for increased resource allocation and policy implementation of the existing laws.
Now, before the project, there was, first of all, low enrollment in schools. There were very few children who enrolled in school, most especially the girls. There were certain cultural practices that were being practiced. For example, we had the FGM, that is female genital mutilation. We had things like childhood marriage or early marriage. We had things like rape, defilement in this community. There was wife beating, children beating, denying children some of their rights, like eating sometimes when someone has done something wrong. And it becomes an issue that was there before the project.
They have also realized that there is a law which is also taking harm if they do that. So we have seen that when I'm there in the health facility, it has really reduced. But not outside, also with our community.
Change of mind. Dialogues helped in the change of mind. We have been disseminating, we have been trying to popularize the Anti-FGM Abandonment Act 2010. And this has really been, it went on well because communities are now getting knowledge about that. Oh, once I subject a child to female genital mutilation, I get this penalty. Once I procure, I get this penalty. Once I, just all those processes. So people, communities are getting knowledgeable about the Children's Act, the GBV issues, and they are trying to ensure that they prevent. And right now as we talk, the number of cases are reducing, the ones we are receiving and handling in the office, they are reducing.
We have increased access to availability of SGBV response services in the areas of health, psychosocial support and protection, key response services that any survivor or person at risk of SGBV should be entitled to. According to Uganda Demographic, a health survey of 2006, 32% of women in northeast Uganda have experienced sexual violence since the age of 15, yet only 1% sought medical care. Mapping, validating, strengthening, and linking referral pathways of service providers in 3 districts of Morato, Amudat, and Nakapiripirit has been done, and the information generated was validated during community dialogues and district SGBV working groups. 23 health workers have been trained in clinical care, psychosocial support, and in health management information system. 33 police and 1 army official have been trained in SGBV management and record keeping, and 22 district officials and teachers have attended a workshop and acquired skills in SGBV management, psychosocial support, and case management principles in practice. 5 meetings to strengthen collaboration and networking between informal and formal SGBV support structures were conducted. FGM and cases of defilement are still issues that require early response, and facilitation plays a key role. We provided stationery for case documentation, work tools, and fuel for transportation of critical cases to hospital and police.
Since we were trained, we came in and we went to the communities, we hold community dialogues, and we sensitize the communities on issues related to gender-based violence. And now the cases that are reporting to the unit are higher because the community is well versed about issues related to gender.
It is part of my work. I will continue doing it. I will not say because the project has ended, I should end no. Because I already have the knowledge, I will continue as it is part of my work.
The coalition worked to strengthen partnership, documentation, and learning on SGBV among civil society organizations in selected communities. Our approach aimed to promote a culture where experiences are shared and learning takes place in a participatory manner. Enhanced learning on SGBV through participation in national and international events of the 16 Days of Activism Against Violence on Women, International Women's Day, Cultural Days. This was a good forum to pass messages on FGM and other bad traditional practices like early marriages among the youth. C&D has organized 3 biannual SGBV stakeholder workshops to facilitate the process of rebuilding and strengthening unity in social networks and to provide a forum for exchange of ideas, skills, and resource mobilization. C&D has strengthened and supported district SGBV working groups to enable the sharing of data, experience, increasing awareness while improving harmonization and coordination of current and future interventions. C&D facilitated biannual meetings for change agents at district levels. These were intended to enhance learning through experience sharing, replenish logistical materials, as well as provide an opportunity for change agents to improve their skills in case management work.
Ayo tinggal dah nyubat kungo sewin lagi nala wajar. Sudah kata kireli yang ala jeba EU ko DCA go C&D le ki mana jangan panang school. Kita tahu ngala mutat, kita tahu ngala porio dan jika munga kama timon munga koran bageston. Atau munga nyata munga bagai ngalon jom bakut gile akwai kanyana karam. Kiwani subina le munga kita sta kelempi ke jole. Walau kita begitu dah kini tu nyana karam.
We need to continue with awareness creation because not everybody might have known the information. We need to have awareness creation. In
Sajomuri jaba taki ang brojo tiana. Mnyoka take mun mone jata konga. Allah nyuma mwanya le minye. Mnyota kuparu. Anda ba ke chora bolo le wudun ma kuparu nyeti. Kemi ya nyile ton kenye ba keminye. Masu etanye. Allah motina ile minye. Allah masu wanyenyu. Ma molmanyo bayit.
Wa kelo kasi sinambola ke saje tu kite men tage muta pile nyagi bakkan. Karama itu kita ada kami tu apa piji kamu tu ke muto na wana lo mele tak lembai lenya apa kenya lenya ki muto tu nona ke muto tu nona
Yara nyu utini kasu yang gimana ngogi bagaimana lasma ibu mau jadi coli tendin tak kenyal kepajane kemana tak lagi pun ada yang menang ada cinyole yo atau kemun mau demu ibu nanya mau lagi mau nanya nama nama katenan ke mau nanya bawa lo kiswa pijo cang le meut pijo mau pasti damu tat temoni karam ke mau seketal nyok kere rapi tem ngerinya pijo meut aku mesti damu tat
inasonga mbele jili
inasonga mbele jili inasonga mbele
jili
inasonga mbele jili inasonga mbele
Njele kwa wapadre
inasonga mbele jili inasonga mbele
Njele kwa wapadre
inasonga mbele jili inasonga mbele
njele
inasonga mbele jili inasonga mbele inasonga mbele jili inasonga mbele
Njele kwa wasista
inasonga mbele jili inasonga mbele
Njele kwa wasista
inasonga mbele jili inasonga mbele